What is the ruling of going to the dentist whilst fasting? So we should try and avoid going to the dentist whilst fasting during Ramadan. We should try to rearrange appointments. We should try and book appointments outside of Ramadan if there is no urgent need. And the reason for this is because of the possibility of something going down the throat. However, if a person is suffering from some pain, he requires medical treatment, then it will not be disliked to go to the dentist. And at the time of urgent need, if, for example, if a tooth is removed, then all possible measures should be taken to ensure that the blood, the water, or whatever else it is that the dentist used does not go down the throat. So you can maybe, if your dentist is a Muslim, maybe ask him, can you take some sort of, be as careful as you can. However, I've spoke to a few doctors, a few dentists rather, and they say no matter how many precautions you take, the likelihood is that blood or water will go down the throat. Even if it is just a normal general checkup, they're saying something is going to go down your throat, regardless of how precautious the person or even the doctor may be. So the likelihood is that your fast will break when you go to the dentist. And in terms of taking a tooth out, if the blood goes down the throat, then the fast will be nullified if, number one, if the amount of blood exceeds the amount of saliva, and number two, if the blood is equivalent to the saliva, and number three, if one can perceive the taste of blood regardless of how the quantity of it, if he can perceive the taste of the blood and it's gone down his throat, then that will also nullify his fast. Kafara will not have to be given, so you're just gonna make that fast up again. And if the saliva is more in comparison to the blood, then the fast will not break. So